Hey everyone, I'm Dr. Willardsen, and today we'd like to go over another case. This is a situation where, a lot of times life comes at us, and we get into a situation where we've neglected our mouth, or we've kind of. I see this quite often, where a patient they get to the point where they're just like, you know what? Why even brush? I'm missing so many teeth. I've got so many broken teeth. I need so much work, why even try? And this is very common. I see this all the time. And this is exactly what happened with this gentleman here. And you can see what's going on. He's missing his central incisors, lateral incisor. The teeth are all over the place. Lots of debris, lots of bacteria on these teeth. Periodontal, notice that tissue is just fire inflamed. It's very red. And so this guy was just kind of like, you know what, I give up. What am I going to do? And that's exactly what happened. But once he sought out treatment and really went, came in for a consultation and talked about, okay, well, what can I do? I mean, I've kind of given up on my smile. I've given up certainly on my smile, but I've given up on my mouth completely. Is there any hope for me? And I hear this all the time, they're like, Dr. Willardsen, is this the worst you've ever seen? And well, I'm like, nope, not really. I've seen a lot worse. So, but let's take a look at this case, because he was pretty down and out, and you'll notice there's just some broken teeth, missing teeth, old fillings, periodontal disease. He's got a lot of stuff going on that we had to deal with. And so this is the upper jaw, and then here's the lower. Same thing happening on the lower. And we got to the point where, like, okay, we're going to have to just take all these teeth out. And usually, because they've been through so many traumatic experiences, for example, this, he would tell me the extractions that he's had in the past were so horrendous that he just was deathly afraid to go to the dentist to even deal with this. And really, that's the root cause. That's the underlying cause of patients who have this situation. It's usually fear-based. And the neglect comes because they have lost hope. And so the beauty of it is there's so much hope in this situation. And when I look at when I first met him and I looked at his CT scan and his x-rays, and I'm just like, oh man, this is going to be so great. So, but take a look at his after photo, and it just completely, this problem is now solved. He is no longer concerned about the way it looks. And guess what? He brushes and flosses and maintains his teeth better than anybody. And why is that? Why did he go from a situation like this, where it's like, oh my gosh, what is going on here? Complete neglect, to this situation where now, all of a sudden, he maintains, he brushes, he flosses, he does everything he needs to do. And it's because he feels better about himself. Now, all of a sudden, he's got confidence. He has pride in his smile. He has pride in what's going on in his mouth. And so, as a result, he won't go back to that situation where he just kind of given up and not willing or wanting to do anything to try to maintain his mouth. And so, so my advice is, if you're in this situation, and if it's fear-driven, if you are, you've spent plenty of time in the dental chair and you've had some traumatic experiences, give us a call, because we do all of our cases under general anesthesia. So you're asleep completely during the entire procedure. And, and it's a situation where it's not just me giving the patient some propofol or some drugs and trying to do the work. We have a board-certified anesthesiologist on staff that's here with me and us in every single procedure. So the environment, not to mention, the surgery center is a JACO certified surgery center. So we take all the necessary precautions so that our patients can comfortably go to sleep and wake up with a new smile. I'm Dr. Willardsen, and thanks for watching.